Hi, my name is Lynette Campbell, and I'm going to demonstrate how to use some assistive devices. There's several gaits that you can use based on your injury, of course. First of all, we have crutches. We have a walker, and we have a 4-point cane, and then of course your good old-fashioned 1-point cane. Right, and when I mean by points, the points are where what is touching the ground at any given moment, whether it be 2 crutches and 1 foot, or 2 crutches and both feet, which would be a 4-point. It depends on what your injury is, okay? So I'm going to demonstrate the 4-point and the 2-point, which are just alike. To me, they've got the exact same movement. The 2-point is just a little quicker. And so it's basically the opposite crutch with the opposite foot. Like I'm going to do left crutch, right foot. Now I'm going to pull the other one up. I'm going to do right crutch, left foot. Then I'm going to do left crutch, right foot. And that is considered the 4-point gait because at any given time, all 4 is on the ground, okay? Like I said, the 2-point uses the exact same mode, okay? It's the opposite foot. So you're going to do right, your left foot. You're going to do left with your right crutch. I'm sorry. But it's the opposite of it. Whatever crutch you're using, you're moving the opposite foot, okay? Then the 3-point is both crutches forward, bad leg, weight on crutches, advance good leg. So I'm going to say that my left leg is my bad leg, okay? So I'm going to go both crutches forward, and then I'm going to swing through, get my right foot up there. Here we go. And we've all seen that, okay? That's probably one of the more common ones. And then of course you've got the swing through, which a lot of people like to play with anyway, okay? And that's just basically what it says. You're just swinging through. And that's all you're doing. You're swinging through the crutches. Okay, that would be if you're trying to avoid putting too much weight bearing on either one for whatever reason. Okay, maybe some kind of surgery or something. But that is your crutches. And again, that takes practice. And when there's nothing literally wrong with you, it's hard to focus on it, but you get the point. All right. Then we're going to do the cane. The cane. I'm going to go ahead and use the normal cane that most people see. So the cane, if you're with the patient teaching them, you should be on their weaker side. And then it says the cane is on the strong side. So if my weaker side, the nurse would be over here because the cane is on my strong side. Okay? And it says move cane and weak side together. All right? So my left side's my weak side. So here I go. And I just bring up the right foot. What it is that cane is supporting the weaker leg at all time. Okay? They kind of move together. Okay? So your cane would be on your right side, your strong side, not your right side, unless that is your right side, your strong side. But the cane is on the strong side, and you move the cane and the weak leg together. Okay, I'm pretending like my left leg's my weak one, okay? Like this. Okay? Same thing would apply with this one, to be the same thing. They tell you you should start out with it about 4 inches from your foot, and it should be even with the middle of your foot. So that should be about it right there. That's how they'll teach you to use it, okay? This one's just the same way. It's just got more balance. And a lot of people are going to these. Of course, the longer legs would be out. And this would be be the opposite leg. So if I just say that my right leg's, this will be my weak side. So this will be on my strong side. So my right leg and the cane would go together. And it just has more balance because of the 4 legs. And of course there's 3 legs. All right, now I'm going to do the walker. Stand on patient's weak side. So we'll say my left side is my weak side. said the back of the walker should match the middle of your feet. So I'm going to say this, but right here is where I should be standing. Okay? And it says lift walker all 4 tips forward, all 4 tips on the ground, then move weak side forward. And with your weights on your hands, okay? So I'm going to say my weak side is my left leg again, okay? So I'm going to just do this. It's going to be my weak side. So I'm going to do all 4 on the ground. All right? And then I'm going to move that up, and the right one's just going to follow. I'm going to move it up, my weak side. And what it does is when I'm moving, when I'm standing back here, and I've got this pulled up, then what that does is I'm putting the weight on my hands to pull that right leg up. Okay? Now obviously if you're going to be doing this, then when you do therapy, you're going to be using your strength here, because at some point here you're relying on your arms and your hands to help you pull that through there. Okay? So you just step it, you just walk into it. Now of course you see people all the time just for everyday support, instead of using a cane, they just do this deal right here. And just walking, dragging to have the little tennis balls on here. So there's different ways, but I just showed you the correct way. Now, you always encourage the patients to look straight ahead. Try not to look down. That helps them keep their balance if they're looking ahead. Also, I want to encourage you, and this will be written on the website, on your blackboard, is that you use registerednurse.com, the nurse Sharon. Okay, she goes through this in detail and gives an example of the walking with each item, assistive device, and how you get up and down stairs, and how you sit down with these devices. The basic rule with the crutches and the cane is up is good, down is bad. So when you go up the stairs, you want to lead off with your good leg. When you come down the stairs, you're going to put the crutch or the cane in front, and you're going to lead off with your bad leg. So you go up to heaven, down to hell, so to speak. That's a mnemonic. Okay, but you can watch RN, registerednurse.com, Sharon. She's a brunette, younger nurse, and I encourage her videos for just about anything. And she talks really plain and simple, and actually shows all these things in order. And like I said, how to go up and down stairs and how to sit down and so forth. So that concludes this video. Thank you.